Welcome everyone. If you're just joining us, we're here in San Antonio, Texas with Dr. Jeneby and Dr. Phillips. We flipped our patient over and now they are starting on the breast augmentation and tummy tuck. They've already done some liposuction and a BBL. If you guys have any questions, feel free to ask in the comments below and we'll do our best to answer those for you. If you're interested in seeing the full procedure being performed this morning, you can head on over to our YouTube channel, and that link is going to be in our bio in the link tree. And if you're interested in scheduling a consultation and you're watching on our TikTok, you can go ahead and fill out this get a quote form. When you fill that out, we'll have someone from our team get in contact with you today, help you schedule that consultation, and then also answer any of your financing questions. Good morning, Brittany. Thank you for joining us.
Already did that? Yep. Okay, so implant. We're trying the new brachioplasty funnel.
Not today.
Not today.
Not on this case.
Oh, not on this. Okay, okay. I think you can do it.
Yeah, I think so too.
I think you can do cash down. He becomes an employee with a chance to get a salary every month.
Yeah.
And then you max out for you cash balance. That would be great for both of you. That'd be a great life. There are some keys to it, but
Right side, 400.
right side, you can't see. You're gonna come to the cash balance from the chair. Alright, but there's stuff going on. See, I didn't really put too much out laterally. Homeboy next. Now you inject.
We are in San Antonio, Texas with Dr. Jeneby and Dr. Phillips. They're currently doing a breast augmentation and we'll also be doing a tummy tuck as well. We've already done a BBL this morning and some liposuction on this patient.
By a month and then get a refund. Yeah, really good need you with this month. So they'll refund you 1 month. No, this is the insurance agent. But you have to put all your valuables aren't then separated into our morning. It's the total value. Yeah, so I will tell you, you're looking at probably your house 12 to 40 grand a year.
For insurance?
You have $1 million of value in the house. Not just that. Planning on a car, or to get it out of the house.
But you're also going to visit the
Full thing.
so like you have to like take that into account.
Oh, yeah.
Like that's huge.
Because you're saving, let's say, 40 degrees a month of taxes, 30 to 40, but I'm charging deductions, so let's say $1,000 a year. And everything's better. Coverage is better.
320 left.
Wait, let me put this. I'm like this and I'm structured. Yes. Here. We're gonna sit her up here in a minute. Also, what's cool about that is you put your bone around. Something happens now. So chances are without a probate, because
Yeah, because
something happens to you and you're love and you're on a plane.
yeah.
You know, it's a business now.
Yeah,
Forever, like
exactly.
Coca-Cola.
Yeah.
Transfer of wealth is easy.
And then if the house sells, it goes into that and that becomes a part of it.
Yeah. Awesome. Put her down. Good job.
Put your hand and can you reach over and turn my light off, please?
Yes.
We are in San Antonio, Texas this morning with Dr. Jeneby and Dr. Phillips. They're currently doing a breast augmentation and we'll also be doing a tummy tuck. If you guys have any questions, feel free to ask in the comments below and we'll do our best to answer those for you. If you're interested in scheduling a consultation, You can fill out this get a quote form over on our TikTok live, and someone from our team will get in contact with you today to help set up that consultation and answer your financing questions as well.
You say, I'll make it a commercial part, but I'll sign it and we'll not be ready for anybody for herself. Doing it for estate planning. I can tell you what to do with the estate planning. Quick clean deed.
We'd like to get all the results. I mean, not that they need to even know, but just in case.
Come on over here for a second. Show me for a second. All right, guys. So what we're doing now, we're going to close up the breast. So we're going to be closing up the breast, and next thing I'm going to do is use the lower end, and we're going to now take care of the tummy tuck. You can ask Deanna any questions you like. You can come in if you want. This sounds like a good boat movement right here, bro.
Wrap it on. It's 90.
Tall.
90.
Did you really put this on?
Yeah.
I love it. You hit the blue cup. Something's going on with it. It's not pumping. Okay, go ahead. Is the new stuff you got? The cheaper stuff?
That is the tubing, yeah.
Good. It works. Stop for a second. Da-da-da. When did you find this stuff? 90s tramp. Did it again?
So I
Good.
heard something a week or so ago. I'm trying to remember what it was. And this is what I
Hit it.
heard and listened to, and I've been known for a little while.
Okay, we're good.
Do we need lights? You said you needed something.
Turn off the
This one here.
Yes.
Now on.
That's off. Okay, so then you cannot call it a homestead.
No, you're out of the homestead, but
And every expense of repair is deductible then.
yep, everything.
What do you close the breast with?
Everything.
And even if it's your
How about
primary
I cut it in
residence, it's okay to do that.
Yes.
I'm asking good questions, alright, at least.
You're doing very good. But obviously, Dr. Carl and those guys
Yeah,
for stuff about protection.
yeah.
Alex, one, it depends on what kind of look you're going for. Two, also it's a good idea to ask whoever your surgeon is, because they'll be able to give you a good idea of what will complement your body the best. It also might change depending on what size cup you already have.
Trust and trust.
What I have personally noticed when patients come in is that usually the 600, 500, and 400 are the most, those implants seem to be the most popular. I personally haven't really seen many patients get 700 or more cc's.
Yeah, go ahead. No, I'm saying, who's coming in? Who's coming in?
Randy, thank you so much. We appreciate your support over on our YouTube Live.
We're
Thank you for
ready
joining
her to
us.
come in.
How many Saturdays has he went into doing the last week?
Nicholas?
Every
That's a
Saturday.
lot.
Okay.
Because he only he's in the military.
Yeah.
He's got to do Tuesdays and Saturdays.
Oh, I didn't realize that he was military.
Yeah.
Okay.
You know how that military thing was.
Does he have an office? Where is it?
Shadow Plus somewhere. Pond Hill Drive, I think. You know, Pond Hill, all those new. When the lane started building stuff.
Sandra, sometimes what happens is TikTok will filter out the questions, so I can't always see what questions are asked, maybe because there is a certain word that was used, and that's why TikTok filtered it out. So if you can just reword the question, so I can see it.
What was the radio station that?
He can't on XM radio.
Oh, that's right. It's been around a while.
Yeah,
Indoctrinated,
Uh,
to the force.
which procedure do you suggest for breast reduction if breastfeeding needs to be preserved? That's a good question. When
He actually learned to kick
one of the doctors has a chance, I will definitely ask that question because that is a very good question.
like he was kicking out movements and didn't kick.
Sandra, so what state are you in? We are in San Antonio, Texas.
Enjoyed the shit out of that.
yeah, the pool filters out the way. Our guy cleaned the pool out, and I guess when he put it back together, it's not totally sealed. I'm telling you, it's like a water weekend. Everything. I put on my oval bracelet, look. My oval, so that nobody's giving me oval. Yeah. Because I'm like, what is all this shit?
So in Arabic, that's called evil.
And Sandra, the BMI limit, it needs to be under 38.
Filter, AC, and water heater. And toilet. We had a toilet.
Okay. Just gonna go back on it. We get worse. Across that aisle.
Randy, so the consultation fee depends on which doctor you're gonna see, and then it also depends on whether you're doing a virtual consultation or an in-person consultation. But whatever the consultation fee is, that is put towards your surgery. Yes. You're good.
Yeah.
Oh my god. But that's not uncommon. Yeah, because it would recover.
I know it is. I also think she has some depression.
Exactly. Oh my god.
Whatever. Dead. We have to say all these
Every so often. I don't want to be in the way though.
busted open, but actually close the calendar. Probably good instead of very.
Yeah. That way you can see the tummy tuck.
Okay. I just feel bad being in the way.
Just don't touch anything blue.
Okay.
And God forbid, if you do touch something blue, speak up.
Okay.
That way
Gotcha.
they can change it out.
Thank you.
Lower risk, Dr. Sinclair, Dr. Furman.
So like you can kind of see like how he's cutting away where her belly button is. So when they pull down, he'll have to create a new hole to pull her belly button through. So it's still in the same place on her body. It's not going to be like up high or like super down low. Like it'll still be in the same spot.
So once they pull everything down, they cut a new hole.
Mhm.
Okay.
So that's a like a quad. That's an well, whether
What's the longest procedure that they do here?
I would say the length of procedure varies doctor to doctor. Because like for example, like if Dr. J was all by himself for this, it would take him 8 hours. But because he has like all the assistants, it takes way less time. Plus he's been operating for so long as well. I would say on average for a lot of his surgeries, I think the longest I've been in surgery with him is maybe 4 hours, 4.5 hours. But that was like someone got like BBL, tummy tuck, breast, or like in something with their face. But I know some of the other doctors, they'll be operating for like 6 hours. But they also haven't been operating for as long as Dr. J has. And sometimes there's not as many people available to help either. Like if all the doctors are working their own cases, they might be in surgery for a little bit longer because they can't come in and assist like how Dr. Phillips is assisting
I was like, man, what's going on here, man?
Dr. J now.
You put out the stud, you know what I'm saying? And then, all of a sudden, man, I was like, what? And then also my hair was falling out there. Now, will nothing fall out my hair.
Good morning. Thank you for joining us on our TikTok live.
when Khaleesi was born, the placenta was full of calcium because of my antibody complexes that infarcted.
The rogue, you were rogue negative and she was rogue positive?
No, because of
You're
my
working with a Jenna from like our
they didn't think it caused the placenta
like
to
from
lose
our
its
office.
blood.
To my knowledge, I don't think we have a Jenna here.
So that makes me think about my heart.
Are you looking to be able to be contacted to schedule a surgery?
You thought wrong. Wrong. You're wrong. Heart disease.
Well, because estrogen is protective, but once you go into menopause,
I recommend if you're wanting her to contact someone from our office to contact you, go ahead and fill out that form.
a lot of estrogen going around.
Don't believe that.
Actually, I've measured Justice's son. He's
Okay.
pretty amazing. On its own, he's got pretty reasonable testosterone.
Really?
Oh, give me any more, then he's probably.
Okay, I can talk to our team to see.
Be like one of those dogs
But what you might need to do is just call the office to talk to them to update your dates for surgery. Instead of waiting for them to call you, I would just call the office. And then Pam, you're a previous patient, and I want to know if you can get a prescription for weight loss. Pam, if you're looking for like the Ozempic, yes, they can prescribe that for you. Go ahead and fill out that get a quote form, Pam. So we can have someone from our team contact you to get you that prescription for the Ozempic.
Well, also, where all the brothers fly, or, and they're looking for him, private Ryan, taking private Ryan.
Oh, yeah.
Pretty amazing.
No worries, Pam.
Oh
Sevia, may I know what are the late complications? Like post-surgery? Post-surgery, something that you might worry about is blood clots, for example. That's one reason why they don't have patients. If they're coming in from out of state, they won't let you fly for about 2 to 3 weeks after your surgery, just to avoid getting any blood clots from being in the plane. Or if you're going to be coming in from out of state but you want to leave, they'll recommend that you go in a car or take a train. That way you're not in the air. But either way, it's safe to say that it's better that you wait to travel back home if you're coming in from out of state to avoid the blood clot complications. And then typically infection, just because you have the from the incisions, but that also has to do with how well you take care of the incision areas in post-op care, so following your post-op instructions. Okay, Pam, I will look for it and resend it to our team. And see if I can resend it to them and have them recontact you. So give me 1 second. And then, how do you sleep with a super mommy makeover? Mostly on your side, because if you're getting the BBL or like a butt implant, you won't want to sleep on your back. But if you also got a tummy tuck and the breast implants, you won't want to sleep on your stomach either. So you'll be sleeping on your side. And then also, if you do get a BBL, there is what they call a BBL pillow for you to be able to sit on.
I think that's enough.
You'll probably want to avoid sleeping on your back or your stomach for about 2 weeks. Full recovery is about 4 to 6 weeks, but you'll still want to check with your surgeon.
The belly button ring right there.
Got a lady coming. She said, "Why do I have a hole right here?" I'm like,
Dude.
I don't know. Then I'm thinking, did you ever belly button patients? She goes, yeah. I said, okay, well, that's what I said. Oh, okay.
They get like really like, hey, what's the medicine? Like, how's your every belly button ring?
There was an RN from TikTok that sent us information last week. Shot on, they got that interview tomorrow.
Good.
Excellent. Replace our girl?
Aww. We're never. I don't think he's going anywhere.
You're going through the big B and it don't mean Dallas. It's a song. Going through the big B and it don't mean Dallas. You heard that?
She just got back.
Of course.
Just got back. Nice.
Yes, but he's been
18.
he's had some issues that are
that's why, or Mississippi right now. Mississippi. Out of the state.
Hi, Fit Dad. Thanks for joining
I don't know
us.
what he's doing. He's not here.
Umbilical. No, the umbilical. Maybe. I don't know.
No, no. Not in the States. So we don't work. Ready? What did you measure? 18. Got it? Yeah. Yesterday. Now she called me, I'm like, nothing does that. Totally. Nice person. But you don't cut that, I'm gonna laugh at you, dude.
For this surgery, the patient is under general anesthesia.
So every year, Memorial Day Band of Brothers does their entire season. 8 episodes.
I've seen that.
It's really good. There's actually a book about it, right? It's based on a book.
I think the last surviving died. Just died.
That was Captain Winters, right? Or Major Winters. He was one of the last survivors. Let's do this. So, Carlos. Carlos booked this Saturday. I would help out a lot. I think last Saturday was just worked out. Oh, yeah, dude. Dude, did you see his car yesterday? That's favor on it. Yeah. Like, we rescued him from favor.
He gets an extra $100 a month for having it on the car.
What?
Driving a favor. So here he is, an MBA CSP. He's driving for favor, right?
How much do you get on that front?
I got, about 200. Right flank. Get this set up for you. need one on.
Have another one.
God bless me with another one. What was that movie?
Got me.
The movie, like, God bless me with another one. Holy crap, this cheese is really old.
$200.
Want to start the upper roll? I haven't done it yet.
Oh, yeah. Yeah, I just wanted to see it.
Yeah, no problem. Yep.
Another song I would listen to as I was driving.
This is we call, what's it called? The Ruse, right? Sandstorm?
Yeah.
Man, this is my Philly song right here. When Justin was a headache because of military.
That's exactly what I was.
Loose.
No worries. Thank you for joining us on our YouTube page to watch the surgery.
Darude. Remember Darude? Sandstorm.
Sandstorm, yeah.
Yeah, I said that. This is your kind of stuff. Rufus Del Sol, Darude.
Yeah.
Not bad. 10:30. Right? 4 cases. Is it 4? Yeah, 3. We started at 6:30. You, Justin, side, the side for Angelica. Good. Much. 100. I actually got my son.
Oh, here, do this right now.
Yeah. Lift that up for her.
Would that be axillary?
Yeah, axilla.
How much?
We're gonna do 100 each. Not much blood loss. I'm gonna estimate EBL at 200 max.
Somehow I feel like when you do this for
Yeah.
other way to fellowship.
I like it.
I
That's
love
where
it.
you go. That's your line. That's where you
I
hit
love
it.
it when you do that. Yo, really likes it?
Done. Somehow I think it sounds like you have a little facetious going on in your head. Alright guys, we're going to give Deanna a break. We're finishing sewing up. And then we're on to our next surgery. Thank you.
Alrighty, guys. We'll see you for our next surgery. And yes, good luck on your anatomy exam.